the back, can you hear us? Good. Assalamu alaikum, my name is Dr. Najeeb. I came a couple of months ago for our program. I'm thankful for Allah for giving me invitation for this. Actually, I'm also thankful for the board to accept that. So this program, and especially your audience, as we attended last time, a lot of people were interested in it. Of course, the board has noticed that, and so that will be helpful. So basically, we have that 12 topics, and we started doing that because we received Sadaqah Jariyah, and then the board also put the money in it. And the goal is, as we are going to get Sadaqah Jariyah, we will continue a couple of times, and the goal is to continue for our whole so that will be helpful. And for Sadaqah Jariyah, it can be done by any one of you, and the board will add money in that, and we can continue for 12 programs once a month. It depends on the board to do it. Okay? Today is the first one. So this is being provided by the Sadaqah Jariyah, and then the board also put some money. So just please remember the person who put the Sadaqah Jariyah for that. So today I'm going to talk about anger behavior and tolerance. This is a very common issue in our community, and it can be much. You can handle the situation if you know about information about that, knowledge about it, and you apply that knowledge. You can handle that issue. So from the behavior science point of view, I will bring those point of views. So you will be aware of it. This is what the neuroscience talk about, how the anger happens in a human, correct? And how you're going to handle that. That's the most important thing. Going to that, we'll have another. This is the common. So these are the common questions people have, and I just brought it up. So these are the questions people have. Can you? Oh, that's much better. So these are the common questions people have, and my actually presentation is based on that. So you can go through each one of the questions and answer yourself, and keep the answer in your mind. And then at the end of the presentation, I will go back to this question. So did the presentation help you? And did you get enough facts and data from that? So usually the first question is the anger a natural behavior of the human being? Think about it and just make a note in your mind that what will be, is it true or false? The second usually people have is the anger a subjective feeling, which varies person to person. So you can have an incident and everybody will have a different reaction. So that's what is called subjective feeling. Is it true or false? The third one is anger a non-reactive response? The fourth question is, can anger be provoked by a non-obvious reason? The next one is anger behavior can be a symptom of medical or mental health issue? And finally, can learning to understand the anger management can improve the behavior response and quality of life? These are the very common questions people have, and I try to put this my presentation based on that. So at least you will not only know the answer, but know the fact and how, if you have anger issue, how you can handle it by yourself. That is the goal of, this is an education program, right? So I'm going to educate you. This is not something therapy or anything, it's just an education. So you will be able to control or try to manage to control your anger issue, correct? And that will be helpful. So I will go, these are the things which we go into neuroscience and psychiatry, first you have to learn this thing, and then you have to apply that in the anger management and anger tolerance and all those things. So the first question comes is, what is emotion and what is feeling? You know? So emotion is an automatic, unconscious behavior and cognitive response of the brain stimulation. Remember, it is unconscious, and it is up for a long period of time. It's inside you, right? So it's a what means something happens. It's inside you. It's not, and you're not conscious about it. This is emotion. Now, the feeling is a conscious perception of the emotional response. So awareness of emotion is the feeling. So what you present at that moment is the feeling. But you have the emotion inside you. And it's at unconscious level. It's a very important to understand what is conscious and what is unconscious. And I will go into detail about that. This is where the fundamental of neuropsychiatry comes in, which a lot of people miss that. Based on this education program, I'm here to help you that. So the next one is drive versus destination. So anger is a drive. It's present in all of us. The question is, which destination you want to go? That's the trick. Huzur Sallam used to get angry, but he never used to express it. His face color changes. Sahaba used to get angry for a lot of times, but they didn't express it, right? So the thing which is very important is it's in your human nature. Just like happiness, sadness, anger, this is in your nature. It's a drive. Then from this drive, you have to go to destination. You can be constructive or destructive. The problem is where you want to take it. So understand that everybody can have, some people have lesser anger issues, some people have more anger issue, because it's a drive already in you. You need to control its destination. And there where the anger management comes. That's one thing fundamental you need to understand. So people who are angry, everybody can get angry. But how you control is the most important thing, right? The next one is boundary violation versus mental health issue. And this is very fundamental for anger management, because we have healthy boundaries. So I have healthy boundaries, my wife will have healthy boundaries, but there are times when I can say my way is highway. So that healthy boundaries is gone. Then you walk into the other person's boundary or your family member's boundary, right? There where the whole issue comes in, the anger management comes in. Because you walk into the boundaries, you cross the boundary. So what is anger? You cross the boundaries. From healthy boundary to you create your own boundary, not respecting other people's boundary. So the other person will get upset. It's a natural phenomenon, it's a drive. So you need to understand that in a normal human behavior, you have to maintain healthy boundaries. If that healthy boundaries is disturbed, then it's a drive. Okay? Now, this is for normal human being with a normal human behavior. But if somebody has mental health issue, the paradigm changes. Now, somebody has bipolar disorder, who will get angry and then upset and then be very happy, right? People with ADHD, people with other mental health disorder. Now, it becomes more tricky When we don't know somebody has a mental health issue, or they don't want to talk about the mental health issue, they have anxiety issues and all those things. So their boundaries is very vague and we are not aware of it. And we get upset with them, not knowing they have mental health issue and they don't want to expose it. So there becomes the boundaries issues. So do you get, this is a very valid point, that healthy boundaries needs to be maintained between a normal, and if there is a mental health issue, we need to be respecting them. And sometimes we don't know. Sometimes they don't want to tell us for their own reasons. So we have tolerance and figure out why they're doing it. Right? So it's very important to know in a normal, with a normal human behavior versus people with mental health issues. The next one is neurotransmitter and neuromodulators. So whenever we have emotion, we have neurotransmitters. Means I can go into detail about that. So we have a lot of neurotransmitter in the brain. Maybe 20, 30, and neuromodulators more than 20, 30 is neuromodulators, correct? So when we have happiness, we have the neuromodulators or neurotransmitters. We have dopamine, serotonin, norepinephrine, GABA, glutamate, and there's a list of it, correct? So these are the few common ones. So when you are happy, you will have a neurotransmitter, correct? When you're sad, you have a different neurotransmitter, correct? So when we give somebody a medicine, that will only control the neurotransmitter, correct? But it will not solve the main issue in the unconscious mind, where it's originating. That thing is still cooking, right? So a lot of time when we give medicine, it helps. But then we will always say that the medicine does not work, because the reason why it does not work, because the core issue is not resolved. If you resolve the core issue, where it's the fire is coming, the neurotransmitter will come down. So you're basically covering and patching the neurotransmitter with different medications so that neurotransmitter stays in a normal hemostasis, so then you don't feel that way. But it's cooking from the bottom, from the unconscious mind, a forceful urge comes, and you have a neurotransmitter more coming out. So that's why the medication does help, but it's not the cure of it, or it will not stop it. You have to go for the real reason why it started. Anger is from the unconscious mind as well as the conscious mind. Keep this thing in mind. The biggest flaw in us learning thing is we always think it's a conscious thing. We miss the unconscious thing. And the neuroscience explain much in detail the unconscious mind contributing to anger. So this is the neurotransmitter, and then you have the dopamine pathway and the serotonin pathway. Dopamine is more on the prefrontal cortex and all those things, and the serotonin is over there. Right? So next one is the most important thing. The conscious mind and the unconscious mind. This is how it looks like. This is just a paraphrasing. This is a picture which really depicts what is going in your mind. Your conscious mind is almost 20% of it. 80% of the information is coming from unconscious mind. Conscious mind makes the decision, but it's getting bombarded by unconscious mind. So when we try to solve the issue on the conscious level, what happened to the unconscious mind? It's still there, and we miss that, right? So if we work on the conscious mind as well as unconscious mind, you cover all the bases. Then the anger issue gets resolved, or at least try to start getting resolved, because you are covering all, especially 80% of the information is coming from unconscious mind. And this is the brain. This is where your thinking take place, prefrontal cortex, correct? Your executive decision making, your thinking part take place, correct? But it's connected throughout the brain. The unconscious mind is this one, correct? This is, and the brain stem is over here. So this is the unconscious mind where your pretty much your emotional center, you have the memories over here is the hippocampus, emotion is the amygdala, you have the thalamus, which is the sensory relay system where all the sensory comes into the brain and it goes to the emotional center, the memory center. These are all unconscious mind. I'm not going to the conscious mind right now. The conscious mind is over here, which is a connection to this unconscious mind, right? This is where the executive decision making place, your judgment, the intellectual thinking takes place, correct? This is connected with this. So when we try to solve the issue on a conscious level, we also have to look at the unconscious level too, to solve the problem. And if we don't solve this problem, you are missing the boat a lot in anger issues. So the goal in psychiatry and psychology is focus on unconscious mind as well as conscious mind. The next one is external versus internal manifestation. So we know the external manifestation we have is, we from the face, from the hand movement, from we walking, the eye, pupil of the eye, the eyebrows, and all those things. And as far as voice is concerned, your actions, these are external when you're angry. The internal manifestation is your heartbeat, respiration, and all those things, correct? We all know that, correct? The goal of this is to work on the long-term goal and the short-term goal. How to fix this issue, right? Now we already know where it's originate, where it's spread. The goal is to fix it. And there where I come in to help you out. This is another way to look into it. So these are the connection pathways. So this is the unconscious mind, giving impulse to the conscious mind over here at the prefrontal cortex. The decision is made and then it goes back over here and then goes to the spinal cord and the reflex nerve. Now you remember the one of the hadith was mentioned that when you are angry, have a seat, and if you're still angry, lie down. 1400 years ago. Yeah, most of the people know that, correct? The neuroscience has already explained in this picture. And this is very important for you to understand that. So when you hear or see things, by vision or hearing, which is upsetting to you, it comes over here, correct? From the eyeballs to the optic. So basically it comes to the thalamus, correct? Which is an unconscious mind, correct? From the thalamus, it goes to the nucleus accumbens and amygdala over there, basically in a hypothalamus over there. And here the response comes in, immediate response, because it didn't like it. The unconscious mind didn't like it. It wants to make right away a response. And when it wants to make a response, it's sent to these centers. These centers basically respond back into the spinal cord, and you have a response. You speak, you say something, you act something because you didn't like it, correct? This is an immediate response, correct? In the meantime, this is called short loop. The long loop is from here, it goes to prefrontal cortex. They think about it. The prefrontal cortex imagine what has happened, what's the consequences are, and then it sends back to again to the center to tell them that it's not worth what you're doing. This is a long track. This takes a couple of seconds, 1 or 2 seconds. And then this center calms down. So do you remember the hadith? When you get angry, have a seat. So when you see, this is where it is active. And if you're still angry, lie down. So you give enough time for prefrontal cortex to act on it and give response back, so you calm down. This was hadith 1400 years ago. Neuroscience has already have established the pathways of anger. is another slide showing how your response is. So basically it goes to suprachiasmatic nucleus over here. It's transmitted to different areas of your body, heart, lungs, thinking and all those things, and you respond right away, correct? So you have to go into prefrontal cortex, give enough time, come back, calm down. This is all set up. It's in your nature. Neuroscience has completely explained in detail. So these are different centers I explained of the dopamine and serotonin which get activated in the neurotransmitters of use. This is just from neurobiology that whenever an event takes place, you have attention, memory, motivation, reasoning kicks in, and your autonomic response is acting on it at the same time. So everything is integrating into it, and you get the response back. So let's come to the goal, right? The long-term and the short-term goals. This is where your work is. So let me go through the long-term goals are. First is awareness and the causes. You should be aware that you do get angry. It's in your nature. If you decline that you don't have anger problem, you're not going to learn. Because Allah has given in your fitrat this phenomenon. Just like Allah has given you happiness, sadness, anger is still there in you. It's part of your nature. So don't fight against the nature. You need to control the response, the drive. And that's what you need to understand. Right? So first thing is to be aware that everybody has this thing. But how they control is the name of the game. Right? So be aware and know the causes. There is multiple of reason of causes. Correct? So you know the reason why you get angry. Correct? So once you know that, you can start identifying. But if you don't know the cause and you say my way is highway, it's not going to help you. Right? Change in the frequency and intensity. So you should look at how much frequency you're having and how much intensity, how significant you're affecting your spouse or your brothers and sister or your kids. That's not good. It is affecting your family life or your friends or colleagues, things like that. The other thing which is long term is you have to work on your conflict resolution. When you have some issue, you need to work to resolve it. Once you think that way, you will work on it. But if you say, I don't need to think, you're not going to work on it. So conflict resolution should be part of the process of learning to resolve your anger issues, right? And development of tolerance and healthy boundaries. As I mentioned, there's a healthy boundaries. Nobody's perfect, right? So you may feel like this person is not understanding, but you have to develop tolerance also. It's not everything is 50-50. You may have to go some way to develop some sort of tolerance, correct? And then other person will get it. But I don't want you to develop tolerance for 100%, because then they will abuse you. So the tolerance has its limitation, right? Somebody is abusing you, physical abuse, emotional abuse. There is a limit, but you have to develop some sort of tolerance, not all the way, right? So tolerance is required because you want to give them time and work with them, right? So this is a long-term planning. In the short-term planning, you have to look at the trigger issues. What thoughts comes to your mind and the time and your response. That is very important. Because the thought comes and how quickly you respond. If you quickly respond, you're not giving time to think. That means you are not using the logical way of approaching it. And you may say or act which you are going to regret. You may be right, but the action will speak, will affect you. So it's better take your time of responding, correct? So the first thing I'll always suggest to them, think about it, take your time, before you respond. Always note medical or mental reason. If somebody has a medical reason or mental reason, like people with sleep disorder, people with pain issues, and all other, there's a lot of other issues. They may have low tolerance and they have anger issues. So you have to be compliant with them and work with them, correct? So anybody who has medical issue or mental issues will be a lot of them, you know. So I mentioned that. The posture change is very important. So give time based on the hadith, right? So your body takes time to think about it, right? The other thing is automatic thoughts versus alternate thought. That is the most fundamental thinking in anger control. So when you have anger issue, you see something or you hear something which really offends you, and you have a response. That's called automatic thoughts, right? And we act on it without thinking. In psychiatry, we say, take your time and have alternate thoughts. And look for the reason for in evidence and against the evidence of alternate thoughts. So you can have automatic thoughts and then you can have alternate thoughts. Take your time. Think about alternate thoughts too. Because automatic thoughts will be on the spot and you may pick up a wrong reason. In alternate thought, you give your time, think about positive, could be right or could be wrong, think about it and then work on it. This is the fundamental thing about anger control, is you need to take time, have alternate thoughts. So your frontal lobe, the executive thinking comes up and think for you, rather than you right away respond for it. So the way we do it, and this is something which everybody can do it. And I will explain to you how we will do it without addressing the main issue. And you can, it works for all of you guys. Breathing pattern. When you get angry, what happens? You have shallow, rapid breathing. What it tells you, the brain, that is a danger response. Your unconscious mind thinks there's a danger. When you breathe fast and a shallow breathing, the unconscious mind, there is something wrong in the environment. And it responds with a stress hormone. The easiest way to resolve this, take a deep breath, hold it, and let it out. You have not even addressed the issue. You're just controlling your breathing. Just changing your breathing pattern for a couple of minutes can make your unconscious mind feel comfortable. When unconscious mind feels comfortable, it's not under stress. And it will send all the information to the frontal cortex to think about it, because they don't need to respond right away. Let's use the logic. This is in your nature. So you change your breathing pattern, take your time, take a deep breath, hold it for a second or two, let it out. Simple thing. And you can do it for a minute, 2 or 4 minutes. Very simple. The second way is muscle relaxation. When you are angry, you tense up. When you tense up, the body realizes there is a danger. Your unconscious mind reacts on it. That's the first thing they talk about. Because unconscious mind is giving all the information to conscious mind. If something is wrong, right? You don't feel right. So, relax. Have a seat. Lie down. These. Right? Sensory interruptions. So when you're upset, you need to interrupt what you're receiving information. So you can look somewhere else, take your time, close your eyes, relax. So the thought of event which is offending you stops. So the thinking process starts. Because if you see really annoying thing, you cannot think because it's basically making you so upset your thinking process. So you stop your sensory interruption. And that is the easiest way to do it. Right? Thought diversion, same thing. You're taking time so the frontal lobe works. Right? The other thing which is very important is self-confidence and avoidance of negative thoughts. You should believe in yourself. Allah has made you the best of the kind. Right? Take your time and take away your negative thoughts. Because negative thoughts will take you in an impulsive manner. So you need to understand, you need to break the negative thoughts with self-confidence. You should believe in yourself, right? Then also, of course, healthy social support in a group setting is very helpful. Relapse prevention plan from the other people who can help you too. Develop tolerance and forgiveness for the past and present. That is very important. Do you know why I said that? Anybody? It's your unconscious mind. See the 70% or 80% coming from unconscious mind. If you don't forgive, unconscious mind will remember it in the memory. It will come back next day or next week because it remember it. So you need to understand, you have to let it go. You can handle that. But don't keep in yourself. Because if you keep in yourself, the unconscious mind will hold it in a memory. And then and this is where it happens. So people were having hard time, they went through, they work it out, and then suddenly a small thing happens, they flare up. Why? Because the unconscious mind kept the whole memory. And you cannot understand why in the small thing flare up this person. Because it was holding an unconscious mind. We miss the unconscious mind. So you hold the memory in your unconscious mind, you are working on your conscious mind. You miss the boat. The majority of the things which happen is that we work on your conscious mind, but not on unconscious mind. Psychiatry and behavior science goes into unconscious mind. The psychotherapy and all those things goes into unconscious mind, figure it out. That's my goal, to make you understand you can learn it and work on your unconscious mind, right? You can make a coping cards reminder. This is how you need to do it, because you will not remember everything. So if you have a card, you can go through it. It will rehearse in your mind, and you know these are things to do. If you keep on doing for 5, 10, 15 times, at least you will get a lot of points done. And if you do every time, by the time you have done 10, 15 times, you will be pretty much catching to the rhythm. And maintenance of behavior patterns. So this is what happens when you're angry. This is just an expression that you lose your mind. Your brain becomes not thinking, it's become an action. And this is what, when you control your anger. You really controls yourself. You control your identity. Even of the worst time when Hudu had, he was controlling himself. He's the best example we have. Look at his sunnah. Look at his lifestyle. He went through the roughest time, which none of you can go. But he never used it to lose. He was angry at times, but he never used to lash out. Why? Because he has Iman. He was controlling his unconscious mind and the conscious mind. With the blessing of Allah, he was doing it. So we need to learn that. So coming back to those questions, hopefully you can answer it better now. Is anger a natural behavior of the human being? What do you think?
Yes.
Good. Is anger a subjective feeling? Varies with person.
Yes.
Good. Is anger a non-reactive response?
No.
Yes, it's it's actually a reactive response. Okay. Can anger be provoked by non-obvious reasons? Yes. Your unconscious mind is having a memory, and it will lash out any unobvious reason. is that anger behavior can be a symptom of medical or mental health issue. Yes. So you need to understand and be tolerant to that, correct? Can learning to understand the anger management can improve the behavior response and quality of life? This is very important for you. The reason why I'm bringing it up is why it's so important for you is that, you know, your relationship with your spouse, your relationship with your friends, family member, marriages get spoiled because what you said. And there are times when you said on a moment, not realizing what you said. Anything said coming out from your mouth is gone, is in the air. You cannot take it back. It hurts people. It hurts. You break the mirror now. It's very difficult to mend it. Time is your factor. If you hold your time, think about it, you won't break that mirror. You will hold your thoughts. Correct? So, understand how you will control your anger. Anger is everywhere, but it's the matter of controlling it. It's a human nature. Control is a factor. And it's not something which you learn in one day. It takes time. People take years. But you will be better off when you start working on it. But if you don't believe that I'm always right, my your highway, you're not going to learn. Your spouse, your family member will get upset. Behavior issues comes up. Your work issue comes up. Down the line, you may lose your job too. You may start fighting with your boss, saying that I'm right, you're wrong. And life goes on, right? So the point of bringing it up is this, what I'm trying to explain, that it's a part of human body. It's a control is a very important portion. Let me go into the take-home messages. Anger is a mental energy of feeling and behavior. First, know and understand the cause leading to the feeling and behavior. External, internal manifestations. You need to work on the long-term and short-term goals. Learning to understand anger management can improve your behavior response and quality of life. That is very important. So what I have told you now is a brief summary of what goes in your brain. Now you understand what goes in your brain. So you can work on it. It will take time. But at least you know from behavior science and psychiatry, this is what happens into you. And everybody can improve. It's not like I cannot improve. Everybody can improve. People with normal behavior can improve and get better. They can be better husband, better wife, better friends, better colleagues. And everybody will like it. Why Huzur was liked the best? Because his behavior. Even in the worst time, he was very nice, gentle to them. When he was even angry, he used to control his anger. The worst anger he had was Habshi. There was a Sahaba named Habshi. He got very angry with him. You know the sequence of it, if anybody knows it. When he accepted Islam, he asked how he killed his uncle. He took his eyes off, but controlled his anger. Right? So people do get angry. It's in the fitra of it. Controlling is the most important. And today I went through each one of them. If you learn the behavior of breathing, sensory interruption, giving time, thinking, and all these things which I mentioned, to think about it. It will help you, all of you. It's a very straightforward, just you need to apply yourself. And all of you can improve yourself. You will be better off next week when you start working on it. After a year, you will be much better off. I think so. This is what I like to present. If anybody has any questions. because I know there's namaz coming up.
I have a question.
Sure.
So how do you learn better about the unconscious mind?
Say it again.
How do you learn about the unconscious part of your mind?
What do you want to learn about unconscious mind? So, okay, let me go through it. That's a good question, Najeeb. This is where the science struggle. We're able to figure it out, but the definition keeps on varying. Okay, good question. So this is your unconscious mind. Means your emotions, your memory, and this area of the brain controls your unconscious mind. It's only when it's connected to your conscious mind when your executive thinking takes place. This is your conscious mind. Like when you're sleeping, your unconscious mind is working, correct? That's keeping your heart rate going, respiration going, correct? That's the unconscious mind, right? But when you are solving a question or thinking about it, that's your conscious mind is working. It's using the logic, critical thinking, analysis, data analysis. So the conscious mind do all those things, data analysis, logical thinking, things like that. The unconscious mind cannot do that. But it can do a lot of other things too. There's sleepwalking. People do sleepwalking. They're using the unconscious mind to walk all the way. In sleepwalking, people have even driven the cars. The neurologist will tell you more detail about that. This is the unconscious mind working. The only thing which they have said that it is not connected. The conscious mind is not connected to unconscious mind. So unconscious mind can do a lot of things for you. So your emotion, memory, other things are all there in unconscious mind. And then it goes to your conscious mind too, where they analyze it and send it back to the unconscious mind, and then goes to the hippocampal over here, where it sends it to the brainstem, and then it's all the way. So it's very important to know your unconscious mind and work on your unconscious mind. Your inner feeling. What you know is your conscious, but there is an unconscious portion too. Did I answer your question?
Yes. I feel like everything you're focused on is basically your conscious mind, and everything outside your focus
It's unconscious mind.
is your unconscious.
I have a two questions, small one. First, if the person becomes angry, but after the person says istighfar or something like that, and the person becoming just smiling or the laughs coming in their mouth. So, what's the science behind it?
Okay, explain to me stepwise. So somebody got angry and then start laughing.
Yes.
The same person who is angry start laughing.
Yes. Yes.
Okay. Did he understood what he did?
So, like that. Imagine a person in the family. So the person become mad or something is wrong.
Correct.
So obviously someone crossed the line or boundary. The person become angry, both of them become angry, common sense. But after the person just wait and be silent or be quiet or say istighfar or something like that, the person, the anger goes away and they start laughing or a smile comes to their mouth. What is the science behind it?
Okay, so there is a defense mechanism people use that. Laughter is one of the defense mechanisms to cope with that. So you feel guilty unconsciously. In response, you have to do opposite of it. And sometimes they do with the laughter mechanism. It's a type of unconscious mind. You know, the ego and superego, and then the whole 9 comes in, correct? So you have the system of opposing it, and some of the people have this laughter issue. But be careful when you're laughing. You should not offend somebody else. If you made somebody upset and then right after that you start laughing, the other person will say, were they really serious about what they're doing, right? So they need to understand, to be cognizant of what they're doing, because you cannot laugh after you have done something really wrong unless the other person calms down You have a civil conversation going on, and there's a laughter thing comes in, and they both laugh. That makes sense.
I saw a person become mad, but the person was not laughing like disrespecting the other person, just like a smiling.
Just a smile.
Just smiling, not laughing so hard, something, just smile and just, you know.
He may have some other thoughts, but this is another defense mechanism. They're trying to cope with that. Internally, at the subconscious mind, they want to cope with it. Something they have done wrong, so now they are going on the other side, just to cope with it. It's an unconscious level of the work.
But other people wasn't, I know the other people was blamed that person. That was not his person, his fault. But other people was wrong. They both become angry, and then the person just talk for a minute. I don't know. Person's.
I don't know about this person because we may have other mental health issue or not. I don't know. In what situation caused that? You know, it's very. I need to know more information rather than.
No, the person was a wise person. That was not just a mental issue or something like that.
Okay.
I was looking if there's any freak behind it that the person calm himself, but just that, and instead of doing something wrong or something that could have bad consequences, the person just control the situation and just smile and walk away.
I
And
cannot
I was
speak
thinking
for.
what the logic the person used.
It's more complicated on the surface. There's more information needed on that, but some people do that. You know, it's a compensated response. Some people do that. But
Because
be
the person
careful.
was very educated. There was not just the order. And other thing I have a question is, does the cold water, when sometimes the person drink the cold water, is gonna reduce the anger or not?
So you.
Because in my country, if someone is angry, okay, give him some glass of water or something like
So you're
that.
giving time to think. When you're drinking, you're giving time to think, right? He's not going to talk while they're drinking.
Give him cold water.
Exactly. You're taking the mind off by drinking, right? You're drinking water, you're having time. So maybe the frontal lobe will kick in and he will calm down. There's nothing to do. And maybe the water goes in the stomach. He feels a little bit hydrated, control himself. Maybe some reason. But you're giving time to respond.
I don't think the cold water or the normal water will make difference. He's saying the cold water, but cold water or the normal water not going to make any difference.
Usually, in my country, someone is angry, they give him a glass of water, take him away. And,
Just a glass of water, you know.
not force him, they just like offering something.
Anybody has any other question? Yeah, go ahead.
Sister there.
Oh, sorry, I'm not wearing my glasses. Apologize.
I just want to say, some people have a sugar imbalance.
Mhm.
When they're hungry or fasting, they lash out.
Correct.
So after they eat, after they drink water, they calm down.
Correct.
So that is a normal thing. But some people have a head injury
Correct.
or they have taking antidepressant, anti-anxiety medicine, they also get angry.
Correct.
So what you do?
Okay. So now you're going to medical disorder, right? Traumatic brain injury is very common. They get angry because your frontal lobe is. It depends on where the traumatic injury is. Correct. Usually the frontal lobe, if the injury is, the feedback from the frontal lobe does not goes to the unconscious mind, right? And it depends on it. So in a hypoglycemia, you know, you are very uncomfortable. Somebody who is in pain is very uncomfortable. Somebody who is not able to sleep for a while, for a couple of days, will be very uncomfortable, right? So there are a lot of other medical conditions. You know, the people with hypertension also get angry at times. You know, so diabetes can get angry, and there's a lot of Parkinson's disease has anger issues. You know, so there dementia has anger issues, and so there are tons of medical disorder which has an anger issue. Your rheumatic disease has, you know, the rheumatoid arthritis, and all where there's a pain, they have low tolerance and they get angry at times. So in a lot of medical disease, they have anger issue, and they explain because of the pain and other issues. Yes. Wait. I cannot hear you.
Sorry. I have a question about the pineal gland, like the third, like the pineal gland in the brain. So like I know the foods we eat and the water we drink has fluoride in it, which means that we're calcifying our pineal gland. And when I did research on it, I know that it's like a very important gland in our brain that is in the process of our emotions, hormones, sleep, production of DMT, and all that production. So I was wondering if we were to decalcify the pineal gland, would that like reduce anger management?
So repeat the last portion. I'm not. Can you come closer, or somebody can convey the message?
I was wondering about the pineal gland because I know it's like
Pineal gland?
Yeah, the pineal gland in the brain.
Pineal gland. Okay.
Yeah, sorry, I was saying it wrong. Because I know it's in charge of like many important functions in the body, and the foods we eat and the water we eat is all consumed like it has fluoride and it damages our pineal gland. I was wondering if we were to take care of the pineal gland, would that like prove a reduction in like mental illnesses and anger management in one's body?
So that is one of the main center for endocrine, right? You have the regular knee centers. They send you all the growth hormone, TSH, all the other endocrine runs over there. It's the main hub, correct? So let me go over there so I can explain to you. So it's sitting over here, correct? It's sending it to the hypothalamus. And hypothalamus is the most important area where your autonomic nervous system works, right? And from the autonomic nervous system is the keyboard, which send all the information throughout your body, the vagus and all those things goes there. So your response to all the endocrine organ is sent through there, right? And then you have endocrine system working through that also. So it goes into so there is two different mechanisms working. You have the endocrine system working and your hypothalamus is working, correct? And there's of course the hemostasis going on, correct? So now you're saying with the food, it's affecting, that's what you're saying?
Like I know the main target of like pineal gland is fluoride because it calcifies.
الله أكبر الله أكبر أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمدا رسول الله أشهد أن محمدا رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله.
Okay, good question. So let me explain to you. The pineal gland is located over here, right? Your pituitary is located over here, right? Pituitary is the main organ which controls the endocrine system. Pineal gland does affect your pituitary, melanocytes, and all the day and night regulation, the sleep, and all those things that take place. So, okay, so it gives you the feedback, correct? So you have a hormonal system working as well as you have the other system working. So if you're talking about anger management, if you are talking about it, so anybody who is depressed can get angry, right? So you look at where the depression center is, right, in the brain. So if you look into the study of the brain study, which is they have drawn the circuit of the brain, the Broadband area 25 is one of the most common area where they do deep brain stimulation surgery and they put the electrodes over there. So in the deep brain stimulation, which is over here, Broadband area 25 is over here. So, so this is an area where the depression, and there's a lot of circuits are involved, correct? So it's not just one thing, it's combination of it, correct? So with the food, it helps you give nutrition, correct? And you need nutrition. And you need folate, B12, and all the iron and all those things are required. So you develop serotonin and all those things. So you need a healthy food, definitely. And it will help you. So of course you need a good dietary source of food. Did I explain your answer?
Yeah, I also was wondering, because I know the subconscious is also dealing with reprogramming of the mind, and I was doing like a bit of research on reprogramming the mind, since like if you speak out like words into reality, because the subconscious doesn't know if like it doesn't differentiate the reality nor imagination. So when you speak anything, it believes it automatically. So I'm like saying, if you have anger management or any illness, let's say, if you were to speak out like words that simply were already reality, your brain would take it in, and it would take a while for it to program, but eventually it will like take it in and put it into the process of your body. Would that like eventually work? Because I know a doctor fixed his spine like that.
Yes, so basically that's what you're saying, that it first comes to unconscious mind. Right? Your thalamus and all those sitting in unconscious mind. If it responds right away, you're not thinking. You're just reflex mechanism you're doing, right? So you have to go to the frontal lobe where the executive function and your thinking, logical thing, and then it comes back to the same center and goes. So there's a forward and backward going on. It takes time. If you do it right away, you are using unconscious mind to reflex it. That's why the anger management works on take time and don't respond right away, or you may say something which you will regret. So, does it help your answer?
Yeah, thank
Okay.
you. Thank you.
You're most welcome. Anybody has any questions? Yes, go ahead.
Hi, so underneath anger, there's fear, fear of inadequacy, fear of...
Sorry, I cannot hear you.
Oh, sorry. I'll be up here. Alright, so underneath fear, underneath anger, there's fear, like fear of inadequacy, fear of something's going to be taken away from you. And so just because that's the base, I guess, emotion, does it run the same as like anger? Do you manage it the same, or does it affect the brain differently?
So fear is one way of looking at it. So anger is a whole, just like headache, right? Anger is a whole 9 yards.
Yeah.
Then fear is just a portion of it. Fear can cause anger. A lot of things can cause anger. So think in that direction. So somebody has a fear factor leading to anger. It may be for one person, maybe not for the other person. They get, they don't get angry, they get scared. The fear causes scaredness rather than being angry. So everybody has a different response, right? Does that answer your question?
Yeah, and so when it is fear, how do you manage it if you're fear?
Okay, so the fear, so it comes to the fear is a general concept, correct? I'm afraid of it, correct? So you go to the psychiatrist to figure out, do you have panic disorder or panic attack or anxiety disorder? Fear is just a broad terminology. Now when you go to the psychiatrist, they find out what the fear is. PTSD is also fear, correct? There are so many anxiety disorder which has fear component. Social anxiety is fear. Separation anxiety is fear. Right? So there are so many of them. So when you go to a psychiatrist, they will pinpoint where the fear is starting. And then they work on it. And then they resolve your fear. And they go in a psychotherapy, go into subconscious mind to work on it. Did I answer your question? Okay, you're welcome.
Okay.
Okay. Yes.
I have heard that when you fake a smile, that you're happy. My question is it that easy to control your unconscious?
That's a very good question.
Yeah, unconscious.
Do you know there was a study done, and they were stimulating their facial expression, and they were using basically they were so before they were working on depression internally by giving medication. Now they were working on the muscles to make you feel happy that will transcend inside you happiness. And they found a lot of success in that. So even if you dress up well, feel happy, and your unconscious mind start taking that and start believing in it, then your unconscious mind get happy with that. So it's not giving the impulse to the conscious mind that I'm unhappy, correct? So you are trying to help by externally to make yourself happy. So even giving a smile to somebody else is sadhka, correct? So they feel like happy that I did something good. That's why they are smiling, correct? So a lot of factor does help. Human mind is very complex. You never know, anything you do good may work. So they have worked on the superficial surface of the human body and they found success in that. And it was very successful in that, but it's not 100%, but they have found that. So it's a good question. Yeah, go ahead. You have to speak loud, sorry, I cannot hear you.
I have a question, but I'm not sure if it's related to what we're talking about here, but some stuff like new devices used, if we're talking about autistic kids who are suffering from controlling their own emotions, like compulsive.
You're talking about autistic?
Yes.
Okay.
Now there's some devices that developed to, like electronic resonance device, used to stimulate the brain in a certain way. Do you think this kind of device are safe to be used, or is it really working well to let the kids better behave, better talk, to stimulate the brain, to stimulate the speech part in the brain? I'm not sure if these devices are working well or are safe in the future. So what's your thought on this?
That's a very good question, so let me answer that question. Autistic disorder is a very difficult disorder. The parents knows the best. And there's no much FDA approved medication for that. We actually try to help the symptoms, correct? Because there's no FDA approved medication that can be used for autistic disorder. The earliest you diagnose autistic disorder is the best for you. The prognosis gets better because you can work on it. And if they start having speech, that is very helpful. That's the first thing you try to do it in an autistic child. So they develop the speech. So that is what they are trying to do, so that autistic disorder person can speak. When they start speaking, they can communicate because they feel like they are lost. They cannot communicate, so they get angry, upset. And only the mother can realize it. When they pick up something, the mother knows what she wants, that my kid wants. Because they want to communicate with you. So that is the goal of them, to help them to communicate. Once the communication comes, they have better outcome. But other things you have to understand, autistic disorder, if you come close to normal, you did the best. Don't expect they will be just normal. But in autistic disorder, there are different types. There are high functioning, there are low functioning. For low functioning, don't expect they will become all normal. If you come close to normal and achieve that, awesome. So that's my suggestion to you.
Yeah, because what I've learned from these devices, like the electronic resonance one I'm talking about, my thought on these, they can mess up the brain or the brain signaling in a way that can cause maybe bring them to seizure, coma, so or mess up their neurotransmitters signaling in a way. So that was my concern. So I was wondering if these devices are gonna be like technologies that are gonna
exactly don't know, but if it's helping your kid or anybody's kid where they can communicate, it's going in the right direction. Because your goal is to have communication. Because they can say, I want to eat, I'm happy, I'm sad, correct? Rather than they shout or be angry, right? So if it's helping your kid or anybody's kid, that's the way to go. But nobody knows the answer right now. Okay? Okay. Thank you very much for coming and